Welcome, everybody. Thank you so much for joining us this evening. We are so excited to bring you the community launch of Heal Specialist Urgent Care. After years of planning, this amazing clinic is now opening and running, and this is the official launch this evening to our local community. So we're super thrilled to have people join us here this evening. We're expecting quite a few people to join this session, and I can see lots of people coming into the Zoom room right now. So I'd love to know what your name is and where you're from. If you can locate the chat button at the bottom of your screen and just type in your name. If you would like to just converse with us panelists and not necessarily everybody on this Zoom call, you are more than you're happy to actually select the panelists only when you let us know that. So just locate the chat button. This is an interactive session. We are more than happy to answer your questions. That is the whole purpose of this event. We want to make sure that you get all of your questions answered before the night is through. So wonderful to see you, everybody. Christy, welcome. Nice to see you. Carolyn, thank you so much for joining us. Rochelle, nice to see you. Thank you so much for being here. We're super stoked that you're able to join us this evening for this really special occasion. So yesterday at Heal Specialist Urgent Care, we actually had our official opening with the Lord Mayor of Newcastle. We had a nice Aboriginal welcome to country ceremony, and we got to hear from Dr. Tim Stewart, who is the CEO and Medical Director of Heal. And tonight we are going to speak to Tim as well and his team, and we've also got a couple of other guests who we're going to introduce you to. So first of all, I would like to introduce you to the Heal Specialist Urgent Care team, and headed up by Dr. Tim Stewart, who's the CEO and Medical Director of Heal. We also have Jason Carney, who is the nurse practitioner and Director of Nursing, and we have Alex McGill, who's the Business and Operations Manager of this amazing facility. Welcome. How are you this evening?
Very well, Michelle. Thanks for having us. Thanks for hosting this event this evening. It's really exciting to see so many people here tonight.
Yeah, absolutely. And you are sitting right there in the kind of central location there of Heal, which has just opened. So let's just really quickly start with a few. I want to show you an amazing video that just shows you and gives everybody a great sneak peek inside Heal. So I'm just going to click over to that. And here we go.
Welcome to Heal Specialist Urgent Care, the region's first specialist-led urgent care clinic right here in the heart of Newcastle. My name is Dr. Tim Stewart, and I am the CEO and Medical Director of Heal Specialist Urgent Care. We're excited to announce the opening of Heal Specialist Urgent Care for people who need urgent medical attention for an unexpected injury or illness, but where it's not severe enough to need hospital-level care in an emergency department.
Our clinic is open 7 days a week, 365 days a year, offering convenient medical care services to the local community.
As a patient at Heal Specialist Urgent Care, you'll experience fast and convenient medical care in a state-of-the-art facility that was designed with your comfort in mind. The clinic comprises 12 private rooms, including 3 extra-large family rooms, a procedure room, a dedicated isolation zone for infectious disease control, and on-site X-ray and pathology services, all under one roof. And we also have free on-site car parking.
Whether you're dealing with a suspected injury, such as fracture, sprains and strains, or a medical condition like respiratory illness, sick child, or a fever, our team is here to provide exceptional care.
We don't stop at urgent care. Our aftercare, including fracture clinic, is designed for efficient follow-up so you can make a full recovery. With an appointment-based service, our orthopedic specialists and physiotherapy team are here to ensure that you get the care that you need every step of the way.
At Hill Specialist Urgent Care, we go above and beyond to make your experience as simple and pleasant as possible. Our concierge service is available to assist you with getting out of your car, and our lounge area service refreshment and snacks. For our youngest patient, we have dedicated child-friendly smart devices and comfortable baby change and feeding facilities.
With our efficient operational systems, technology, and optimal staffing, most patients are seen by a medical professional and on their way home in under 60 minutes. And with our walk-in service, you don't need an appointment or a referral. So visit us today at 96 Parry Street, Newcastle West, and experience the difference at Heal Specialist Urgent Care.
Brilliant. What an amazing facility. Now, Tim, tell us about your vision for Heal Urgent Care. Where did it come from? What is your background and how did we get to this point?
Yeah, thanks, Michelle. It's been a long time in the making. Certainly, I had the idea well over 5 or 6 years ago now when I attended a conference in the States and heard about urgent care for the first time and thought, wow, that's a really interesting concept as a bridge between community services and the emergency department for medical conditions that just aren't severe enough or life-threatening enough to require hospital-level care. And can be provided in the convenience of an independent standalone clinic with all of the services under one roof and staffed by, appropriate medical staff, including emergency trained clinical staff who are used to working in an emergency department and can pretty much handle any emergency that walks through the door. So working in public emergency departments in Australia for the last 20 years, it's become apparent to me that the hospital system is becoming overwhelmed and overcrowded. And I'm sure we all can relate to an experience that we've had personally, or we've had a family or a friend who has experienced long wait times in the emergency department for something that is really sort of low severity, but simply ends up in the emergency department because patients often have nowhere else to go. So that was the problem that I wanted to fix for community, but also for our colleagues in the emergency department to help offload the public health system and to ease the burden on those emergency departments and allow those employees and clinical staff and allied health and all of the staff that go into making a hospital system, allow them the time to focus on the real emergencies and let us handle the urgent care people who need and can be managed safely in a community setting like ours.
Fantastic. Now, tell us about the actual clinic itself. I have had the privilege of going through it and having a look, and it kind of feels like it has all the facilities of a hospital, really, but there is a level of warmth to it that you just can't describe until you actually experience it. Can you tell us about it?
Yeah, I mean, most people when they walk in here for the first time, they say exactly those two things, that, oh, wow, it's like a mini hospital in here. You've got everything under one roof that you'd expect to see in an emergency department. And those are the vital ingredients of creating an urgent care clinic that's successful and has the scope to be able to manage most patients in community. You need the infrastructure, the appropriate clinical space with the right resources and equipment. And for us, that includes plain X-ray and rapid pathology tests where we can get a result in under 10 minutes. And also, as I said, the right mix of clinical staff with the expertise to be able to manage emergencies in community. So that mix creates a great alternative to the emergency department. But then you need to add the vital ingredient, which is the calm, relaxing space that we've got here. And that's the other thing that people notice when they walk in. That's the first thing they comment on is, wow, it's really calming and relaxing in here. And the reason for that is because of the design and the great work that the interior design team from Evoke Projects have done on the place, and the color, the use of color. We've got greens and pinks and shades of grays, which are very relaxing, calming colors. We've also got murals and artwork on the walls. In the lounge area, we've got some scent and also some music playing. And so that really fills the senses and provides a fuller experience, I suppose, and certainly is a world away from a busy, chaotic emergency department in hospital.
Yeah, absolutely. Now, Jason, tell us, what kinds of ailments, conditions, accidents, those types of things can people come to Heal Specialist Urgent Care with?
So that's a good question. So to sort of make it sort of explain a little bit easier. So to determine on what should go to emergency department and what we see, if you require an ambulance to get somewhere, you probably most likely need to go to hospital. Or if you're thinking you're going to need an operation or a hospital admission, then you should go to a hospital. But besides that, we're then equipped to see most things after that. So we can see children, sick kids. We've got a full isolation zone. So if you're coming with infectious diseases, you know, gastroenteritis, COVID, pneumonia, we can see that also. And if you're sporting injuries, if you've got something in your eye, you might have a headache, we encounter for all these things. And we've also got plenty of information on the website on the sort of injuries and also the medical conditions that we would see. And if there's anything that you're not entirely sure of, you can give us a call, and we're more happy to discuss what's going to be suitable for you if you're suitable to come in and see us at the clinic.
Yeah, fantastic. Now, I was in a situation where my daughter had broken her arm, knew it wasn't a really severe thing, you can just tell as a parent, but still needed to get it seen to. And we had to go to 3 or 4 different places and drag her around with this broken arm. Can you tell us about the facilities that you have there to make it a better patient experience?
Yeah, so from the initial presentations, you come in, you're greeted by concierge staff. So whether it wasn't a broken arm, let's say you got a sore ankle and you need assistance from your car, we've sort of got access where you can sort of call concierge. They can meet your car and actually bring you through. So we're trying to help you from before you even present. From once you come through and you're sort of seated in the lounge or into one of our assessment pods, the nurses will see you, make the assessment, offer some pain relief if needed, provide some splinting so you're not sort of dragging your poor child around with a broken limb. And then also we will arrange an x-ray on site so we can get the x-ray done while we're here. We can make the interpretation of what the diagnosis is and then also apply any sort of splinting procedures that we need to do. So whether it's a plaster, or a splint or something like that as well. So we can do it all in one spot, and we aim to sort of get all that done in under 60 minutes.
Amazing. That's incredible. And 7 days a week, correct? So your sports injuries on weekend sports and those types of things, you can get access to all of these amazing services with x-rays and pathology, etc.
Yeah, 365 days a year. I mean, it's really critical that people are able to access healthcare 7 days a week. Just not sure where this business hours for healthcare came from. It's certainly not convenient for people when they need help on the weekends, particularly with sports injuries. I mean, where else can you go and have an x-ray on a Sunday? And we offer that here. We've built it like a mini hospital to be able to provide that service.
Yeah, fantastic. And speaking of other services, I really want to get to in a moment that whole patient experience, because that just blows me away in terms of the service that you offer. However, we do have 3 special guests here as well, and we will just introduce them. So Rosalind Meyer from Sonic Health and Hunter Imaging. Rosalind, welcome. How are you?
I'm good, thank you. Thank you for having us here tonight.
You're very welcome. We would love to hear about what Hunter Imaging has provided here at Heal Urgent Care, and what that is going to enable patients within the local community to access.
Absolutely. So Hunter Imaging are very pleased to partner with Heal Urgent Care, and we know that this is going to ensure doctors and patients have access to timely general X-ray services. And that's a service that we can provide 7 days a week because we're there on site with Dr. Tim and all of his healthcare colleagues. Hunter Imaging is the market leader in diagnostic imaging services in the region, and we can really see the benefits and the value that he'll provide to our healthcare system, not only in the urgent and after hours space, but also across a full spectrum of primary care and specialist emergency care services. Ultimately, from this service, it's going to be the community that's going to benefit. The partnership here is strengthened with Hunter Imaging's size and scale across our region, and that gives us the ability to provide a 7-day-a-week X-ray service to support our healthcare services there. Personally, for us, we'd really like to thank Dr. Tim Stewart and all of his colleagues for giving us the opportunity to be able to partner here with them and provide this service to the community.
Yeah, fantastic. Now, Rosalind, am I right in saying that there's not many other options, particularly on a weekend, if you want to receive an X-ray and needing one? Lots of accidents still happen on the weekends. Is that correct?
Oh, absolutely. So you see the majority of X-ray services that you get after hours or after lunchtime on a Saturday is, you know, generally a presentation to your emergency services department. You know, we all have sports. All of our kids do sports, and usually, if you have an injury to a limb or, you know, a fall or a concussion that you need X-ray for, there's no services available for patients to present to where they can get that service all in one under one roof.
And I guess the only other alternative is sitting in emergency, which for a less severe injury, you're going to be sitting there for quite some time because you're just not going to be a priority.
Oh, absolutely. I mean, when you're presenting to the emergency services department, you've got, you know, things that are determined as absolute emergency. And unfortunately, children's injury and sporting injuries really drop to the bottom of the list there. And sometimes you're looking at, you know, an 11, 12-hour wait, and you just can't do that. You know, if you're a parent, you've got 3 kids in tow, you've got to get somebody to the emergency department, you've got to keep everybody under control the whole time. If you've got a service that you can present to and be seen within 60 minutes and, you know, be on your way home for dinner, that makes everybody's life a lot easier.
Absolutely. I'm sure all the parents in the audience are nodding their heads. Absolutely. Thank you so much for your time, Rosalind. Really appreciate you joining us this evening. Secondly, I'd like to introduce Elizabeth Cottrell from Lavity. Welcome. How are you, Elizabeth?
Good evening. Welcome. Thank you. It's nice to be here.
So tell us about what services Lavity are providing here in Heal.
So Lavity, as Tim mentioned, have provided 2 point-of-care testing analyzers, which, as he said, make results available around sort of 10, 15 minutes, depending on the result. What a lot of people don't realise, I think, is that pathology is so important in the diagnosis of knowing what is wrong with a patient. So this gives Tim and his team a really good snapshot of what's happening, and then they can make decisions based on what they're getting on how to treat the patient. So Tim first approached us probably about 18 months ago, and I said, oh, Tim, you know, like our lab's like, you know, 5 minutes down the road, we could do really quick results for you, like a couple of hours or same day. And he was like, no, that's not going to work. We want something, you know, on site, and we want, you know, in and out, you know, as quickly as possible. So we, you know, put our heads together, and ultimately, yeah, these point of care machines are only really seen in hospital, ICU and theatre sort of situations. So yeah, I think it's definitely the way of the future. It's definitely, you know, these machines, you know, people want everything really quickly. So and it's all backed by you know, the Australian standards and accreditation, and support from our, you know, labs and licenses. So yeah, no, we're really proud to sort of, you know, as I said, partner with Tim and his team, and you know, be the first to sort of, you know, have this model up and running and being successful and promoting our service. And like I said, anything that is not tested there urgently, you know, as I said, we've got a local lab in Adamstown, so there is another quite large range of testing that we can get back quite quickly, mostly same day, if not, you know, the next day at the absolute latest. So
Yeah, fantastic, Elizabeth. Well done. Thank you so much for joining us this evening. What a great service. And again, you know, the speed in which we are managing patient care here, not necessarily rushing you through the doors in and out, but making sure that we're able to provide that speed of service to get you home quicker. Now, I also want to welcome David Naylor from Ethos Health. Welcome, David. Nice to see you here.
Thank you. It's great to be here, and yeah, thanks to Tim and the team. It's certainly been very exciting the last couple of weeks with the opening, and obviously a fair bit of work in the background leading into it. But yeah, Ethos Health, they're very excited to be involved with this as well.
Absolutely. Can you tell me what Ethos Health provides in terms of services?
Yeah, sure. So Ethos Health is a large allied health business. We've got a large physiotherapy team, very experienced in a lot of areas, including acute care and casting. So initially, we're going to be involved with the aftercare service. So we've had our first day in there last week, so working alongside some of the orthopaedic surgeons. So we're going to be doing some casting, plastering, so, you know, working with the team in that side of things. And then certainly as the service expands, we look to expand the service that we can provide as well. So obviously there's big opportunities, I think, with working with some of the community sporting teams as well. And we'd look forward to becoming involved in that side of things as well.
Yeah, fantastic. And what a great service to have there on site, because the last thing you want to do, particularly as a parent or anybody, is to have to go to all these different locations before you kind of finally get that diagnosis, the x-ray, understanding what situation you've got, and then obviously going through to that casting phase and on your way home. So thank you. Amazing service that you're providing. And I think it's going to be a really good patient experience all round with all of these 3 different services available all under the one roof. Fantastic. Now, Alex, let's talk about the patient experience, because I know that a lot of meticulous planning and detail has gone into making sure that even before a patient walks through the door, that they are being extremely well looked after. So can you tell us a little bit more about all those little things that you do to make sure it's a great experience?
Yeah, sure can, because I love talking about it, Michelle. I think what's at the heart of HEAL is a love of service. So, you know, all of our team do the roles that they do because they're driven by service. And so when we were coming up with some of the ways that we could care for people who come to HEAL, we were thinking, how could we make it easy for people? And also take away the unknown, which usually happens when you end up in an emergency or an urgent situation. So we start with online bookings. So, you know, if you've had a sick child overnight and you're not sure what to do, there's an opportunity for you to jump online and make an appointment and be here first thing 8 o'clock in the morning with that certainty that you're going to be seen by our team of experts and be on your way. We do say that we'd like to see people in and out within 60 minutes. And when we say that, we certainly don't mean that we are rushing or that we're cutting any corners. But what we've done is we've implemented some amazing technology, and we've taken away the waits, because we don't actually have to wait for the ambulance that comes in, or wait for the x-ray machine, or wait for the bloods to come back, as you've heard from our partners. So those little bits of waits all add up, and can be 4-6 hours. So we're really proud when people say, wow, that was quick. And I know they're not saying it wasn't worth it. They're certainly saying it was well worth it, because they were able to go home and plan their day. Some little things we do in our car park, we've got QR codes on the signs. So if you come into our car park, so we have on-site parking, which is unusual. But if you come into our car park and you scan the QR code, it will call straight through to our concierge team, who can come out and help you. So whether that means just showing you where the door is, bringing an umbrella, wheeling out a wheelchair that we might be able to help you in with. And then we just really make sure that everyone knows what the next steps are. So, communicating with the people who come in to have care is really important. And I think, unfortunately, what happens in a busy environment, such as an emergency, you do tend to become your illness or your injury rather than the person. So we're really focused on making sure that we're caring for people, not patients. You might hear, I actually try not to say that word. I refer to people as people coming for care, because it's important that we show, and we want people to understand that we are working with them as they heal from their injury or their illness. We're not telling them how to do it. So we want to fit in with their life. We've got family rooms, so that example of you saying, what do you do with the kids? We've got a lovely room that they can come and sit here and watch some videos and wait. We've also got access to other suppliers or providers. If you do have that fracture on your arm and it does need surgery, we've got links to our orthopedic specialists, so we can make that happen a lot quicker. So when we say we make healthcare easy, as I said, we don't simplify it, and we don't cut corners. We just take away all the noise and fuss and give you exceptional patient care.
Fantastic. And dare I add that there is even sparkling water on tap for patients.
I do wish it was champagne, but it is sparkling water, yeah.
Healing water.
Healing water, yeah.
No, that's amazing. So Tim, tell us about particularly your focus on the family experience when you come in, and particularly, I love that you're able to kind of ring ahead, because I can imagine you've got a couple of kids in tow. One of them may have cut themselves, or can't walk properly, and you've got a baby as well, and a pram, and this and that. So tell us about the facilities that you've got there for local families.
Yeah, sure. Well, I mean, we all have families ourselves, and we understand how stressful it is with little kids, let alone little kids with injuries or illnesses that are really cranky and grisly with a fever, and then the other siblings kicking off because they're not getting attention, and they want to be at home in front of the TV and getting dragged around the doctor's surgery. So yeah, we get all of that, and we just wanted to make it as stress-free for parents as possible. So those are some of the ideas that we came up with, were around, phoning ahead, letting us know that you're coming. We can meet and greet you. The booking system, so rather than walking in and taking your chances with availability, you can pre-book a slot to see our clinician team, and then we'll see you at that designated time. So picking a time that's convenient for you. And then the ability to pre-register, still under development, but coming soon, being able to pre-register for the clinic before you even get here, and prepay, so that when you come, you just basically coming straight in to see our clinical team and getting attended to right away. Those efficiencies cut down the amount of time that people need to spend in the clinic, and the feedback generally was from parents that we want to have a great experience, but we also want it to be fast and efficient, and we want to get in and out and on our way home as quickly as possible without cutting corners or simplifying things like Alex said. So then it's about the space that we put you in, and that family room that Alex was talking about. We had a family in there with 4 kids the other day, and we're handing out free toys for the kids. Like, they're only, it's minimal cost for us to give those kids a treat, but geez, their eyes really light up when they see that toy box and we tell them they can have one gift each. And then all of a sudden, one of the kids was asking us whether we did kids' parties. They were so delighted with the service, and they're getting some snacks.
And the lollies, yeah.
Yeah, and the lollies and the snacks, and they're getting some distraction from, you know, eating. We put the TV on for them. They've got Netflix. They've got, you know, iPads that we can wipe clean after use. There's a bunch of games on there that they can play, and it just makes the time in the clinic much less stressful for the parent and much more enjoyable for the kids. And then, you know, after being here, we also have a feedback process where we can get a conversation going with patients, and they can call us if there are any problems, following up results, and just knowing clearly what the next steps are in that care plan, what to expect, and having that documented and sent digitally to their phone so that they've actually just got a copy of it in their email, rather than having paper that often gets lost somewhere along the way. So the feedback from that has been excellent, and parents with families have been leaving certainly with high levels of satisfaction, and we've been getting loads of 5-star Google reviews, and it's been really encouraging to see that.
I think that is a true testament when you have a young person who wants to have their birthday party there. It just says it all about the experience, I feel. And particularly, you know, a medical environment can be a daunting environment for a child. So I think that it shows that every part of that patient experience has gone well above and beyond to bring that experience to life. So that's amazing. Now, I just wanted to clarify. So you can walk in if you've had an injury and you do just need to walk in, absolutely. And there is still no wait when you walk in. And you can also book ahead. So that is really for, I can see that would be a good idea. I've got young kids. I might be waiting for my husband to come home from work to look after the other kids, and I want to book ahead. So you can also do that as well, which is a fantastic facility to be able to do that. Now, tell us about aftercare and the fracture clinic that you've got there as well.
Well, look, we've got so much space here that urgent care simply wasn't enough. We had to provide aftercare for people who need follow-up. And it's fairly standard when you have an injury like a broken bone that you need, like the broken bones take 6 weeks to heal. And so you're into a temporary cast on day 1 to allow for swelling. And then usually at week 1, you have a fiberglass cast put on, more comfortable, waterproof, more durable. And then at week 6, generally, that fiberglass comes off, and then you're off to rehab with the physio team. So during that 6-week healing process, you really need regular follow-up with an orthopedic team and an orthopedic surgeon to make sure that that bone is knitting and healing properly, and that you don't need an alternative course of therapy like an operation, for example. So that involves repeat x-rays, consultation with an orthopedic surgeon, and also input from our physiotherapy team at Ethos Health. And they're all on site in what we call a fracture clinic, which is conveniently located in the tenancy adjacent to urgent care. So aftercare is a follow-up appointment-based service, and fracture clinic is one of the services in aftercare. We are developing other aftercare models, and we're really excited by the potential to follow up people who otherwise get lost to follow up or have nowhere to go and can't access follow-up healthcare in a timely manner. So, you know, we could run a variety of clinics there, wound dressings clinic, burns clinic. There's a whole host of ideas that we've got around that. And also in that aftercare tenancy, it's a separate entrance from urgent care. And there's a variety of consultation rooms, as well as access to our x-ray facilities, procedure room for doing things like wet plaster and fiberglass, and also Laverty Pathology conveniently have a collection point there. So people with a referral for blood collection or pathology from the GP or specialist can go there off the street for bulk billed blood testing to be done 6 days a week, which is a great service for the local community, you know, is separate to our operations here in urgent care, and helps keep things running smoothly without mixing the people that might need both those services.
Yeah, fantastic. What an amazing facility. Now, I've just got a question here, and I will remind everybody, if you do have questions, you're welcome to just put them in the chat and we'll work through those. But the first question is, what are the opening hours of HEAL at the moment?
So the opening hours, currently as we are, it's 8 a.m. through till 6 p.m. 7 days a week, 365 days a year.
Fantastic. No, that's great. So if I just remind everyone, if you do have a question, we'll just wait for you to type those questions in.
And on the opening hours, I mean, we are planning on extending those hours. Ultimately, we'd love to be open from 7 till 11. But we got to start somewhere, and we're building it from scratch. And a 10-hour window was what worked for staff, and 8 till 6 was the feedback that we got from community that was the best time. So ultimately, though, it won't be long before we're open much later in the evening and earlier in the morning.
Yeah, fantastic, which is a great thing. And again, it's always after hours, really, when you need that assistance, particularly on the weekends. We've got another question here. So are you able to tell us what the costs are and what that cost structure is, and also the value that is provided within that cost structure?
Yeah, absolutely. And look, it's a great question. And as Tim said, you know, we are starting from scratch, and we're a private company. So there are lots of things we would love to do, and we're petitioning government to help us with that. But by providing our expert specialists that we have here on site, you know, 10 hours a day, and we also have our nursing team are all level 8 registered nurses. So we've really been able to pick the most experienced for the roles here at HEAL. We're able to offer the service for $295. And with that, you actually do get, if you are a Medicare card holder, you do get a rebate back for that initial fee. Everything from then on, we take care of with Medicare directly. And that includes the x-rays that you have with Hunter Imaging and the blood tests that you may have with pathology, and the cast that our cast specialist here, Jason, puts on for you, or the crutches and the boots that you might need, or the script and the starting medications. So remembering that our one of our values at HEAL is making healthcare easy, and by charging the simple one fee, it just means that we're able to take care of everything for you. So we're not sending you off to various places to get lots of things done. We're able to manage that for you, so that once you are finished with your episode of care here at HEAL, you really are on your way to healing, and then you don't need to go and find all those things. So look, as I said, we're petitioning the government to support our practice, and you probably have heard a lot in the news about urgent care being the key word at the moment. We just want to say that we're here and we've started it, and we love serving the community. So far, we've kept 154 people out of the emergency department in the 2 weeks that we've been open. So we're really proud of that.
Absolutely. And if I look at the option of, you know, that fairly modest fee versus sitting in the emergency department for an extended period of time that's going to disrupt my workday and those types of things, it is certainly well worth the investment in health. Now, we've got another question here. What is the process if you see a patient that does need admission to hospital?
Yeah, well, we are expert emergency trained clinical team, and we can tell that pretty much within a few minutes. In fact, we had a patient here this morning that came in by a private car with some broken ribs that we had diagnosed within a matter of minutes. He had a lung ultrasound and a chest x-ray, and we knew from the minute he walked in the amount of pain that he was in, that he needed to be in hospital for admission and on a morphine drip. And so we started that process. You know, we looked after him. We provided pain therapy, strong pain medication. We did the necessary tests to make sure that he was stable while we waited for the ambulance. And then the ambulance came and transported him to the most appropriate emergency department, which was the local trauma hospital. And there was no charge for that service. We don't charge people who need to be in hospital because we help them navigate the healthcare system. And if we can tell as soon as you walk in the door that your severity or your acuity is much higher than you thought it might have been, then we'll help redirect you to the best place and the safest place for you to receive care. And, people are really grateful of that. We hate telling people they have to go to hospital, and we try and avoid it as much as possible because, like I said, we want to offload the public health system, not increase the burden. But when you need to be in hospital, people appreciate that you're open and honest with them and that you give an explanation as to why they need to be there and why it's beyond our scope of practice and why it's not safe for us to treat them here. And the fact that we don't charge for that expert consultation, I think just really demonstrates not only our goodwill, but just our willingness to help people and make sure that they get the care they need.
Yeah, fabulous. I think that is an amazing thing to be doing. And, when I guess what everybody needs to understand is that the specialists here are kind of the same specialists that are in the hospital, correct? So you're seeing the same expertise. You're just in a facility that you need to be in a facility that requires you to be admitted to hospital with that extra level of care. So, that's really the difference. And to be able to come in and actually be able to speak to somebody who knows what they're talking about and is able to give you the best advice is a huge benefit to the community. Absolutely. Another question here, can clients be seen by the aftercare service if they haven't initially been seen in the urgent care clinic? Or is that pathway only offered to the urgent care clients?
Yeah, we've been getting a lot of those questions, and that's really interesting for us. Initially, we're developing those processes and we're starting with aftercare for urgent care patients. But given there's so much interest in community to be referred from, say, GP with a broken bone to see our specialist team, then we're definitely going to be developing those models to allow that to happen because that's great for people. And the alternative is the public hospital fracture clinic. And we know from talking to people that they would prefer an alternative if it was available.
Fantastic. Another question, are you able to refer to private specialists for ongoing review or intervention if appropriate, or does the patient then need to go back to their GP to get that referral?
Yeah, look, we try and make it easy. We make healthcare easy. That is one of our core values. And sending someone back to the GP for a referral is just adding an extra unnecessary step. So if we think you need an MRI, we don't ask you to go back to the GP to order the MRI. We book you a priority MRI with Hunter Imaging Group, and you can have that within a day or two if you like. We can do the same with referrals to different specialists. The one thing we can't control is the waiting time for that appointment with the specialist. So we can't control how long it takes for people to get into specialists, but we can certainly facilitate the referral, and we can have a discussion around, who our preferred providers are, who might have more availability and who might be able to see you quickly, and certainly just helping people navigate the healthcare system again.
The other thing, Michelle, that people have been reaching out to us about is that they don't have a GP and they're really struggling to find a GP. And we're really proud that we had quite a few big practices locally reach out to us and offer to take our patients or to take people who need care as a priority. So that's, if you get stuck and you come to urgent care for an injury or illness and you don't have a GP, we've got a pathway that we can align you with someone who's in your area to help with that aftercare as well if you need it.
Fantastic. Another question then, does that kind of communication go back the other way? So if someone presents themselves at Heal Urgent Care, let's just say in a scenario where they can't get an appointment for their GP, do you then communicate back to the GP with regards to what the situation was and how that was treated?
Yeah, so all communication, so to their GP, we do privately through a secure messaging system. It's medical objects, and so the patient will receive a copy for themselves, or they get their own patient discharge. And like Tim was saying, we do that digitally to their email, so that's their copy. And if there's anything we need to pass on to the GP or notify or update any change or anything we've done, we also notify their GP as well.
Yeah, fantastic. No, that's great. Question, is there a plan for a CT scanner in your facility in the future?
We have considered the CT scanner. They're very expensive machines. They take up a lot of space, but we're very lucky with Hunter Imaging that we have access to CT Monday to Friday at the Derby Street practice, which is less than 400 meters away. It's literally 3 blocks up the road, and they have very kindly offered to prioritize our patients, and we can most of the time get a same-day CT scan. And that's quite a common thing, particularly with suspected fractures, because sometimes the x-ray just doesn't show the fracture, and there's a high clinical suspicion of a fracture, and those patients usually go on to have a CT or sometimes an MRI. And that follow-up testing is really critical to guiding the patient as to whether, in fact, the bone is broken or not. Because if it's not broken, you can nurse it and expect that it'll get better in a week or two. And if it is broken, then it's a different trajectory. You probably need to be in plaster or splint or a boot for usually around 6 weeks. So that decision-making and that advanced imaging is really critical to what we do and is part of the service that we can offer.
Fantastic, brilliant service. Now, in recent times, particularly, there has been a lot of people in the community who are suffering from mental health issues. Are you able to tell us about how you can help those people?
Yeah, of course. I mean, mental health crisis, mental ill health, and mental distress, often multifactorial, triggered by situations or multiple situations all on top of each other, and it just leads to this point where patients feel helpless and often have challenging emotions that make it really difficult for them. And accessing care at that time can be particularly challenging because it often happens very quickly and can be quite a rapid process, and they really need help quickly, and there's a big gap in services there, and actually, our emergency departments are full of people experiencing mental ill health or mental distress because they simply have nowhere else to go. And the admission rate for mental health across the region is really quite low compared to the admission rate for non-mental health people. And what that tells us is that most of these people can and should be managed in the community, but yet there's no real community services for them to go to. So what we wanted to do was to provide an environment that is safe and calming and appropriate for those people to sit and talk and tell us about their issues, and for us to make sure that they're safe, that they have support, that they have a knowledge of what to do if things do get out of control, who to call, and that they have a follow-up plan in place. And the GP, the general practice primary care physician, is really critical as a keystone in the community to providing that mental health care plan. And so we link patients back in with the GP, and we may also be able to prescribe some short-term medications to see them through that difficult period. Often it's an issue with lack of sleep because of stress and anxiety, and we can definitely help with that. And then, as I say, it's organizing follow-up and making sure that they're linked in with existing community services.
Yeah, fantastic. What a great facility. And I did view the room that you have beautifully set up for that scenario as well. So it looks like an amazing facility. Do you know what the approximate Medicare rebate is?
Yeah, we do.
Yeah.
Can you tell us?
It can vary because the way Medicare works, it's really based on what the doctor is diagnosing and what procedures that needs to be undertaken. But for the consultation, we expect that you'll be a minimum of $38 as your rebate. And that can go up to just over $75 if say you've been to your GP with your suspected fracture and then they've sent us a referral, you're able to claim a little bit more back on that. And as the year progresses, as people know, once you get over your 80% safety net, you get a lot more back on those outpatient services that we offer. But there is certainly an opportunity there for Medicare to help, and also help on the other side, that if you do have, some suturing that's needing to be done or a fracture that needs to be to put in a cast, that Medicare will cover those costs as well.
Yeah, I mean, we all know that Medicare is broken. Patients just aren't getting the rebate that they should be getting. And we could never run this service on $38 a patient, which explains why it's not bulk billed. And those factors that determine the rebate are outside of our control. But like Alex said, it's the duration of the consultation or the complexity of the clinical problem, and even things like after hours. So you get more back if you come here on a weekend than you would do if you come Monday to Friday. So that's great. I think that the people who need healthcare most on the weekends are actually going to get a bit more in their back pocket.
Yeah, amazing. I think that's a great answer to the question, and we've certainly all seen the news commentary about that particular issue recently. Are your staff trained with dealing with those people with disabilities that may have different behavioural issues when seeing a medical professional?
Yeah, so like we were saying before, most of the staff are all from an emergency department. So we're used to dealing with people with disabilities or behavioural difficulties, and we can actually provide a better service here because we're taking away a lot of the stimulation, we're taking away a lot of the the environment. So like part of the design is keeping it calm, having rooms where you can actually make it a bit quieter, sensory stuff so we can turn the light down. So there's a lot of things we've actually incorporated and tried design so we can actually treat these people and provide a much safer and much nicer environment than what they would normally have.
Yeah, fantastic. No, that's great. And I did notice a lot of those the sensory toys there for kids when I was visiting, which is great for parents who need that as well. Fantastic. Excellent. Well, we have made our way through all of the questions. Thank you so much, everybody, for joining us this evening. And come and visit HEAL. It's a great facility, and the Newcastle community is so privileged to have this available and to be there for you whenever you have an injury, an illness that doesn't necessarily require being admitted to hospital, but also, you need to see somebody about that. It's going to give you that peace of mind to be able to do that. And, it's an amazing experience when you come here. Who would have thought there is something called a concierge for anything related to medical services and the fancy sparkling water on tap as well. So all of those things just make a brilliant patient experience. And that's really where HEAL comes into its own, and make sure that you get back home as fast as you can to start your healing journey. Fantastic. Thank you so much, Tim and Alex and Jason. We really appreciate you being here. Thank you to our guests as well. We appreciate your time. And HEAL will be open again tomorrow. So if anything happens tomorrow, the next few days, then you know exactly where to go.
Yeah, that's right. And the website is healurgentcare.com.au. There's heaps of information on there, including what we see and a book now button for those people who would like to reserve a slot with the clinical team. And also the phone number, which is 1300090009, nice and easy to remember. And concierge can help guide your call and answer any of the questions that you've got. And if you have a clinical question, we can direct you to the clinical team to help you, again, navigate the healthcare system.
Brilliant. And Tim, just remind us of the address and where you can access that convenient parking as well.
Right, so the address is 96 Parry Street, which is actually the corner of Parry and Union Streets in Cooks Hill, opposite the #1 sports ground, behind Aldi, and parking is accessible off Union Street. We have 10 patient car parks exclusive for urgent care use. And yeah, we're you can't miss us. We've got a big red cross on the corner of the building and Heal Specialist Urgent Care over all of the awnings.
Fantastic. Thank you so much, everybody. Thank you, everybody, for your time. We value your time, and we appreciate you being with us this evening to hear all about Heal Specialist Urgent Care. So have a great evening, and we'll see you again soon. Bye for now.
Bye. Thank you.